Good morning, and thank you to everyone who is either joining me right now or is taking the time to listen to the recording. Yesterday, February 23rd, we reported the second death associated with the COVID-19 community outbreak at Skyline Landslide Apartments. The health unit has not yet received the cause of death. However, the individual tested positive for COVID-19 and had a preliminary positive for a COVID-19 variant of concern, or VOCs. On behalf of myself and the staff at the health unit, I want to extend my sincere condolences to the family and friends. At this time, I feel it is important to give you an update on the local situation, including outbreaks and COVID-19 VOCs. With regards to the community outbreak at Skyline Landslide Apartments, as of yesterday, February 23rd at 3 p.m., 42 individuals have tested positive for COVID-19. This includes within the apartment, visitors, and other contacts that we've been able to link through our contact tracing. 27 individuals have a preliminary positive COVID-19 VOC test, which we are still awaiting the results for, but may not receive the results for all samples. 2 individuals have passed away. 2 VOCs are confirmed as being VOC originating from South Africa. 2 school shutdowns as a precaution, given how much more contagious the variants of concern are. I'm thankful that Sunset Park Public School was able to return to in-person learning on Monday due to no additional cases identified. This is the difficult part with public health at times, to understand the success of prevention measures like shutting down the schools and having no new cases, when we are unable to compare it to what could have happened. On Friday, February 19th, we declared an outbreak at Castle Home, a long-term care home in North Bay. While we sent a public service announcement out on Monday, I feel it's important to address concerns about some results being false positives. At this time, the health unit is working with Castle Home and the North Bay Regional Health Center to investigate the outbreak. We're consulting with local and provincial experts in laboratory medicine and infectious diseases regarding COVID-19 test results of some of the individuals who tested positive. We have received conflicting expert opinions as to whether these tests were truly positive, or are now working with these experts to really determine what the results mean. And based on the Ministry of Health's COVID-19 guidance, it is not appropriate to clear an individual of a COVID-19 based on a retest alone. However, the peculiar circumstances at Castle Home over the recent weeks really warrants further study. No matter the outcome of further investigation, Castle Home remains in outbreak due to the following: an essential caregiver with a positive screen for COVID-19 variant of concern, or VOC, has symptoms compatible with COVID-19 and attended the facility during their infectious period. This is not a false positive. Requirements of the Ministry of Health's COVID-19 guidance on managing cases, data provided from the original COVID-19 test results. Some of the individuals having symptoms compatible with COVID-19. Asymptomatic individuals who tested positive for COVID-19 connected to symptomatic individuals. COVID-19 tests are quite accurate. Public Health Ontario reports false positives happen in less than approximately 0.01% of COVID-19 PCR tests, or polymerase chain reactions, meaning that these tests are about 99.99% accurate. We need to have trust in the labs across Ontario. If it is determined that some of the individuals did not have COVID-19, we will respond accordingly. VOCs are 50 to 70% more contagious than the original version of the virus. The burden of variant of concern, or VOC cases, are significantly greater in our health unit district and increasing. Since January 28th, 63% of all of our district's COVID-19 cases are VOC, either confirmed or directly associated with the VOC outbreak. This percentage of VOC cases is significantly higher than the rest of the province. We are seeing community spread of VOCs in both Nipissing and Parry Sound districts. Community spread means that the individuals do not know where they caught the virus, and they have not had travel outside of the district or known contact outside of the district travelers. My role as Medical Officer of Health is to protect the health of the public. Decisions I make are not easy and are informed by the current scientific evidence, knowledge, and experience we have gained since the pandemic began. We consult with trusted experts and we listen to your concerns. It's truly a balancing act. We know that public health measures can help to slow the spread of the virus, prevent everyone from becoming ill at the same time, and prevent our healthcare system from being overrun. However, these public health measures must begin early, they need to be strict, and they must be followed. We have also learned that loosening restrictions increases social interaction and increases the risk of spreading the virus. We really have a small window of opportunity to try to stop the spread of VOCs in our communities. If we do not continue precautions to prevent a surge of COVID-19 VOCs, more people will become ill and more people will die. We may then require measures such as prolonged shutdowns or school closures, which will have profound harmful effects on youth and people struggling with poor mental health, violence, or addictions. I've heard concerns specifically from the District of Parry Sound about the extended shutdown. While case counts are much lower in the District of Parry Sound, it is important to note that there are 2 confirmed preliminary positive for VOC. The strain is currently unknown. The exposures related to these cases were community spread. While it is frustrating to remain in shutdown, the North Bay Parry Sound District as a whole must rally together to get through this together. The shutdown measures are also worrisome for our business community. The government is offering financial aid to help keep local businesses afloat, but at the end of the day, it's the customers that help local business owners put food on their table and support their families. The local business community has been so cooperative in helping keep our communities safe throughout this pandemic. And we hope you will find ways to support them from home if you are able. The vaccine is coming. However, it will take time before we're able to offer it to everyone who is eligible and wants to be vaccinated. I'm committed to keeping you informed on the vaccine rollout by providing regular updates. Until we've been able to vaccinate the majority of the population, we need to continue following public health measures. And these include staying home except for essential reasons, physical distancing of at least 2 meters, wearing a face covering, washing or sanitizing your hands often, covering coughs and sneezes. And if you start experiencing symptoms of COVID-19, self-isolate immediately and arrange to be tested. Overall, I feel that our district has done an excellent job following public health measures, making a real difference to our local situation. So let's continue these efforts by staying home, staying safe, staying kind, and saving lives. I'll now answer questions submitted by the media. I've grouped similar questions together. So first, we'll discuss the Castleholme outbreak. PJ Wilson, Castleholme. How concerning is the large number of false positive results from the testing? In particular, the numbers from Castleholme released Friday. If the false positives do in fact turn out to be negatives, will that be reflected in daily and cumulative COVID numbers issued by the health unit? This time, the health unit, Castleholme, and the North Bay Regional Health Centre are working with experts to determine if any of the individuals from Castleholme outbreak did have a false positive. If the experts do determine that individuals did receive false positives, then we will adjust our numbers accordingly. We want to ensure that our data reflects the actual situation within our district. We have a surveillance team who work hard to ensure that our data is free from errors. If we are getting a large number of false positive test results, this is an issue that we need to resolve with the laboratory experts with whom we are consulting. COVID-19 community outbreak, Skyline, Landslide Apartments, Kylie, Jennifer, Hamilton, McCharles, Nugget. I understand residents at the Landslide were retested for COVID-19 this week. Do we have the results from the first time and results of VOC? When are we expected to get the second test results? Why have the VOC cases only increased since the end of January? The North Bay Regional Health Centre COVID-19 Assessment Centre, with the support of the health unit, offered a second on-site testing clinic to the residents of Skyline Landslide Apartments on February 16th. Approximately 80 residents were tested on the 16th, and since then, 10 additional individuals received a positive result for COVID-19. We only had our first preliminary positive VOC case in January 2021, which is also the only confirmed variant that we have, a VOC originating for South Africa. Today we learned that there is a second one that has been confirmed. All of our other VOCs are preliminary positives, meaning they have a gene mutation associated with the VOC, but we need lab confirmation on the exact strain of the VOC. Due to the volume of samples being sent to our provincial labs and lab capacity, we received confirmation from the provincial lab that not all of the preliminary positive VOC results will be genotyped. If we receive additional results, we will share them publicly. And you can track the positive cases associated with the Landslide apartment outbreak and the breakdown of preliminary positive and confirmed types of VOC on our website, myhealthunit.ca/outbreak, where case numbers are updated Monday to Friday. Greg Esterbrooks, why was there a delay between the health unit discovering a positive test at the Landslide and informing the residents of it? Some residents feel that this is the case. There was no delay. On January 28, we received the first positive result of an individual who lives in the Skyline Landslide apartments. One individual testing positive for COVID-19 does not warrant a public notice, and we made the public aware that an individual in our district had a preliminary positive VOC on February 2nd. What prompted the public health investigation was when a public health nurse in our communicable disease control program noticed that another individual who tested positive had the same address as a previous case. Through case management and contact tracing, it was determined that the individual who tested positive on January 28 did not have a known connection to the new case, apart from living in the same building. This was identified on February 5th. On February 6th, the health unit made the residents and public aware of a cluster of COVID-19 cases within the Skyline Landslide apartments. Health unit staff, wearing full personal protective equipment, went door to door in the apartment building that same day to inform the residents about the COVID-19 situation in their building. Since then, the health unit has set up a webpage to inform residents and the public of positive cases associated with Landslide. And this page is updated daily, Monday to Friday. Alana Pickrell, CTV. Do we have any idea why there were so many cases in that apartment building, how it spread? We're consulting with public health experts to better understand the rapid spread among apartment residents, and engineers are currently assessing the building to help determine what the cause of the spread is. Likely the spread is through a combination of factors rather than one single mechanism. Chris Dawson, Beta Day. Did your health unit or the province ever create apartment-specific protocols for tenants within large complexes, such as the Landslide in North Bay? Individuals living in multi-unit dwellings are expected to follow the same protocols as everyone else, such as washing or sanitizing hands often, maintaining 2 meters from anyone outside their unit, especially in shared spaces like laundry rooms. Only ride the elevator with other tenants if you can stand 2 meters apart, and wearing a face covering when unable to keep 2 meters apart. The health unit has been providing information and education to residents, managers, and staff at the Landslide apartment in an effort to slow the spread in the building. As we learn more about the transmission of the virus at Landslide, we'll be able to support similar residences in preventing outbreaks. Switch to the shutdown. James Bowler, Your TV Muskoka. I'm reaching out in regards to a recent letter sent to the North Bay Parry Sound Health Unit regarding the current lockdown situation in the area. The letter was sent from the Parry Sound Chamber of Commerce asking for detailed reasoning why the area is still under a lockdown and requesting the area be reopened. The current threat we face is the most serious since the pandemic began. While the COVID-19 case numbers and deaths are decreasing throughout Ontario, variants of concern are on the increase and spreading rapidly. The burden of VOC cases are significantly greater in our health unit district and increasing. We have VOC community spread, including in the Parry Sound district, meaning individuals do not know where they acquired the virus. We have had 2 people in connection to an outbreak, and both have preliminary positives for VOCs. The following data is illustrative. Since the onset of the pandemic, Toronto Public Health confirmed our preliminary ratio of VOC to total cases is 0.75%. Our ratio in the North Bay Parry Sound District Health Unit for VOC to total cases is 11.8%. Since January 28 till yesterday, 63% of all of our district COVID-19 cases are VOC, either confirmed or directly associated with a VOC outbreak. This is significantly higher than the rest of the province. VOC spread 50 to 70% more easily. The science tables, modeling projections are alarming. The recommendations to avoid a third wave and third lockdown is sticking with the stay-at-home order and aggressive vaccinations. The VOC has spread beyond the apartment building outbreak to 2 school cases, necessitating the closure of 2 schools. Both the Nipissing and Parry Sound districts have VOC, unrelated to one another. The VOC strain in the Nipissing district is from South Africa, and we're still awaiting confirmation of the Parry Sound district strain. Due to vaccine shortages, only first doses have been given to all long-term care home residents, elder care First Nation individuals, and staff. Only a few healthcare workers in long-term care homes, so doses wouldn't be wasted. An alternative level of care, hospitalized patients awaiting transfer to long-term care have been immunized. No hospital healthcare workers, 4 hospitals in a district, have been immunized. Hospitals within a district have limited resources and surge capacity, especially if healthcare workers become ill with VOCs. Other vulnerable populations within the community have yet to be immunized. Public health measures can slow the spread of the virus, prevent everyone from becoming ill at the same time, and prevent our healthcare system from being overrun. However, these public health measures must begin early, they need to be strict, and they must be followed. We've also learned that loosening restrictions increases social interaction and increases the risk of spreading the virus. For all of these reasons, I have recommended to government to remain out of the response framework, similar to Toronto and Peel, and continue in shutdown with the stay-at-home order in place. While I understand the frustration, now is not the time to be opening up. Eric Thompson, West Nipissing Tribune. The number of VOC cases in the region is apparently enough to justify continuing the shutdown for several more weeks, but not enough to keep skating rinks, tobogganing hills, and snowmobile trails closed. Is there any actual data to support reopening these activities, or are you just throwing people a bone so they'll put up with 2 more weeks of stay at home? It doesn't matter if we are in or out of the response framework. If we have evidence of large groups of people together not following COVID-19 public health protocols, I will close the activity. These activities are only allowed to be open if stringent safety protocols are in place and are followed. PJ Wilson Nugget. What is your response to repeated public calls, including from a North Bay councillor, for a more detailed justification for North Bay Parry Sound remaining in lockdown? Why, with the district's weekly case numbers per capita, doesn't the region qualify for the color-coded framework, in this case yellow? The province even mentioned this number in their press release on Friday. What is the % positivity rate and reproductive number for the local region? The decision to remain in shutdown was based on a number of factors, as I have just detailed, and assessed with reference to a Public Health Ontario guidance document on returning to the framework. While epidemiological data such as incident rates and % positivity rates of COVID-19 are important when making this decision, other factors such as the number and complexity of outbreaks, community transmission of the virus, hospital and public health system capacity, as well as threat of the variants of concern with its increased transmissibility are also major factors. At the time the decision was made, between January 28th, our first individual to test positive for a VOC, and February 18, 68% of individuals who tested positive for COVID-19 also had a preliminary positive VOC. You can review the video on our website or our YouTube page, which explains why we're still in shutdown. Hypocochical, what is the number of cases that the health unit would be comfortable with in order to loosen up restrictions on small businesses and move our region into a color code? There is no specific number of cases we are aiming for. While we certainly want our case numbers to be coming down, the epidemiological data, such as incident rates and % positivity rates of COVID-19, are only some of the factors we use to make this decision. Other factors, such as the number and complexity of outbreaks, community transmission of the virus, hospital and public health system capacity, as well as the threat of the variants of concern with its increased transmissibility, are also major factors. Vaccines. Tony Rima, CTV, Northern Ontario. I want to ask about the North Bay Parry Sound District Health Unit's proposed sites and hiring staff to meet the need going forward. So the health unit will be utilizing a number of locations for immunization clinics, depending on the group being immunized and the potential number of individuals. Our 5 main hub sites for our large mass immunization clinics will be North Bay, Parry Sound, West Nipissing, Mattawa, and Sunridge. For large-scale general population clinics, the arena in each location will be utilized to host the clinics. Conversations have been ongoing with the municipalities to arrange space. Dates will be determined as we work through the phases of the vaccine rollout and based on vaccine supply. For smaller clinics, a smaller hall may be considered within the arena if available. Additionally, smaller targeted clinics for specific populations, such as age or profession-specific groups, will be held throughout the district. Locations will be based on a number of individuals who meet the criteria for the targeted population and the availability of space suitable to host clinics. We are not taking a one-size-fits-all approach, but attempting to meet the needs of the groups being immunized. From a staffing point of view, we're exploring a number of options. Hiring is underway to increase our registered staff who are able to provide immunization as a part of their scope of practice. Additionally, conversations have been initiated with a number of our community partners to recruit assistants, and many of our primary health care partners have reached out and offered assistance to provide immunization clinics. Additionally, we have been in conversation with our local post-secondary school education institutions to explore the option of having students from various programs, such as nursing, paramedic, office administration programs, providing assistance to our clinics. The health unit has also undertaken a continuity of operations assessment process to identify staff positions that are able to be deployed to support immunization clinics without compromising our ability to continue to provide public with access to our priority programs. PJ Wilson and the Nugget. Is there any indication when the next batch of vaccines will arrive? The health unit needs to provide the second dose of vaccine to individuals who have already been immunized. Once we have this completed, we will let the public know and provide updates on the number of people fully vaccinated. We're also working with the Ministry of Health to determine when shipments of vaccine may arrive and what type of vaccine will be available. Once we start to immunize other priority groups within phase 1, we will let the public know of the progress. Eric Thompson, West Nipissing Tribune. Adults 80 years of age and older were recently added to phase 1 of the vaccine rollout. When, where, and how can 80-plus-year-old residents in the health unit region expect to get their first dose? Last weekend, the Ministry of Health updated the phase 1 priority groups into 2 sections: immediate priority for first vaccination and next priority for first vaccination. Adults age 80 plus fall into the next priority for first dose vaccination. We're currently not taking bookings as we await vaccine supply. The health unit is currently focusing on completing the first group in the immediate priority for first dose vaccination category. There are 3 other groups identified that need to be completed prior to the adults 80 years of age and older. As the supply of vaccine allocated to the province from the federal government increases, we anticipate we will receive shipments of vaccine on a regular basis, which will allow us to continue through the list of priority groups as recently updated by the Ministry of Health. Once all immediate priority for first dose vaccination groupings have been vaccinated, the COVID-19 vaccine will then be available for adults 80 years of age and older by appointment. It is important to note that our health unit is not yet booking appointments in our district, but we will notify the public when we are ready to do so. How much will this change impact? How much will this change impact when our district will be ready to move into phase 2? By adding additional population to our phase 1, adults over the age of 80 years of age, we are simply moving a group from phase 2 to phase 1. This will have an effect as there are considerably more individuals in phase 1 now than previously. So it will take a bit longer to work through the phase 1 and requires more vaccine to complete. Variants of concern, Greg Bowman, Moose FM. How do you determine a preliminary positive result? Different labs use different tests, so they also report results in different ways, making this a difficult question to answer. It can be confusing. Lab tests vary in their ability to detect very low levels of virus versus confirm with reasonable certainty that the specific infection you're looking for actually exists. Certain labs will report an indeterminate result, meaning that the laboratory could not confirm whether this was a positive result or not. Further testing or assessment of the individual symptoms would be required to determine whether this was a positive or negative test. In other instances, results may come back positive, but it seems unlikely to be true, given the individual's lack of symptoms or lack of exposure to sources of COVID. In that situation, sometimes a second test is requested to confirm the result. Why are you able to determine a preliminary result so much quicker than a confirmed result? Well, certain tests, such as the rapid tests that are being used in some workplaces or for school screening in other parts of the province, are not very reliable and are just used for preliminary screening. All positive tests from these tests need to be confirmed with a PCR test and are treated as probable until that confirmation occurs. So the health unit must interpret results based on the individual symptoms and the risk of exposure to COVID-19. While the health unit is conducting this assessment, we continue to treat the results as positive. If there is concern based on the assessment that the test could be incorrect, then further tests are ordered to confirm, which can take some time depending on the test. Greg Bowman, Moose FM. Why has it taken 3 weeks to determine how many more confirmed variant cases there are? Jennifer Hamilton McCharles, The Nugget. Why hasn't the number of confirmed VOC changed in weeks? Why is it taking so long? How many test results are we still waiting for? Have any come back negative? PJ Wilson, Nugget. According to the Ministry of Health and Long-Term Care, we are supposed to receive confirmation of VOC within a week or two from when they've been submitted. What is the status of those results? Chris Dawson, Beta Day. Why is it taking so long to get information on the type of variant of concern that is within our community? Can you shed any light on that? Individuals are tested at a COVID-19 assessment center. Their samples are then moved to a lab anywhere in the province. The samples are tested to determine if they are positive for COVID-19 or not. Once a test is positive for COVID-19, it goes for additional testing to determine if there is a gene mutation associated with the variants of concern. If this is determined, we are notified by the lab and we refer to this as a preliminary positive VOC. This sample is then sent for additional testing to determine the exact strain originating from South Africa or the UK, or for example. There are many steps in this process, and with labs receiving so many samples, it takes additional time. At this point, we have received confirmation that 2 VOC cases from the apartment outbreak originated from South Africa. Due to the volume of samples being sent to our provincial labs and lab capacity, we received confirmation from the provincial lab that not all preliminary positive VOC results will be genotyped to determine if they originated from South Africa or UK or Brazil. If we receive additional results, we will share them publicly. Brad Oman, Moose FM. Though a recent release from your agency mentions VOC spreading more easily than regular COVID-19, is it deadlier? What kind of underlying health conditions did this person have, if any? There are many unknowns about all the VOCs. We do know that the confirmed variant we have in our district, the variant originating from South Africa, does spread 50 to 70% more easily. We have already experienced 2 deaths that are part of the same outbreak as a single confirmed VOC case originating from South Africa. We need to follow public health measures to help prevent any more deaths from taking place. I cannot provide information about the health status of an individual who passed due to the Personal Health Information Protection Act. What we need to remember is 2 people have died, and we should all be doing everything we can to prevent this from happening again. Some general questions. Dean Belanger, KFRM Radio. When we take live questions from the media in a live Zoom call or not pre-selected questions or pre-recorded video? Eric Thompson, West Nipissing Tribune. Many people gathered outside the health unit this week to protest the lack of transparency surrounding your decision to extend the shutdown. Requests to elaborate on the decision have either not been responded to or met with a regurgitation of the local COVID stats devoid of any provincial context. Even now, you're reading submitted questions off a computer instead of hosting an actual media availability session. Do you think your health unit is doing a good job communicating with the public? Where can you improve? We communicate the reasons behind our decisions openly and in a timely manner. So of course, yeah, there's always a room for improvement in all things that we do. I do not have all the answers to all the questions related to COVID-19. I wish I did. We try to advise the public of what we do know that informs the decisions we make. We cannot communicate based on rumors. We need to ensure the accuracy of whatever we put out. We also prioritize the needs of the community partners with communications. As an example, would parents be okay with hearing that their child could be at risk of COVID-19 through the media or directly from the school and the health unit? My guess is through the school and the health unit. So we prioritize ensuring every parent of a high-risk child is contacted before we publicly confirm any information. I can understand the frustration about the way COVID-19 restrictions are allowing our press conferences to run. However, we do not pre-select questions. All questions are answered. And by having questions submitted prior to the press conference, we're able to pull all the required data. As you can understand, there's a team of people who work on COVID-19, meaning I need to connect with departments to find the information you are looking for to ensure you have the most accurate and up-to-date data. So thank you so much for all your questions.